A very good afternoon, everyone. I'll be presenting this keynote address on behalf of Dr. Subhav Parshad as a co-author. The caruncle, derived from the word caros, is a fleshy structure that is located in the inner canthus. It is often referred to as a vestigial organ, but is it really one? Let's dig in and find out with a diverse spectrum of caruncular lesions. When this patient presented to us in the OPD, there was a high degree of unfamiliarity in our approach to address this case, and thus we decided to look into the records. Conducted a retrospective consecutive interventional case series on 36 eyes of 34 patients over a period of 20 years. Initially, we performed a case-specific history and a comprehensive clinical examination, went ahead to do the surgical excision following the oncological principles. An excision biopsy with 4 mm clinically clear margins was done with base cryotherapy and reconstruction was performed. With the mean age of 55 years, we had a higher preponderance of males with unilateral presentation in 94% of cases. Most common presentation was a medial canthal mass followed by epiphora. Among the various spectrum of lesions as shown in here, it shows that caruncle harbors from the adnexal elements such as hair follicles, sebaceous glands, sweat glands and accessory lacrimal tissues, thus giving a variety of lesions on the caruncle. Majority of these lesions, that is 80% of them, were benign with 20% rare malignant lesions. These are the corresponding histopathological images, and histopathology is the most crucial point in this. 14 different types were found as mentioned below in our 2-decade-long study. When compared with other larger series, we found that nevus and papilloma were more commonly seen in the other case series. However, sebaceous gland hyperplasia and lymphoid pathologies were found to be in a larger proportion in our study. These are some excellent post-op outcomes at 2 weeks after an excision biopsy with ocular reconstruction. This is a patient following 6 weeks of visit with complete excision biopsy and no chances of recurrence at all. The lesions in the caruncle are plethoric. They range from developmental anomalies to serious rare malignant lesions. It being true to its name is truly a transitional zone. 2 such interesting cases, one of which was like a 2 peas in a pod where coexistence of 2 different pathologies was seen in a case. This patient on histopathology was found to have OSSN and amyloidosis both. On histopathology, we found pale eosinophilic acellular deposits in a form of nodular lakes, and visualization under polarized light showed us apple green bifringerance. This is an interesting case where the fleshy mass at the medial angle showed a follicular lymphoma. Later, the patient also had a Richard's transformation from follicular lymphoma to diffuse large cell B-cell lymphoma in several other abdominal organs and thus received systemic chemotherapy for the same. Caruncular masses are diverse as shown, and 80% of them are benign. These lesions are rare, but multiple components in them suggest that clinical diagnosis and management can be difficult. Ocular pathologies are a doorway to systemic workup to rule out multi-organ development. Thank you.
Thank you.